I'd like to ask Mary to tell her story of how she came to homeopathy and what sort of ordeal she went through, and her daughter, Kathy.
Well, Catherine now is 9 years old, and a year ago when she was 8, she was just a healthy, well-developed child, and occasionally she'd get an ear infection or sore throat, but other than that, she had been fine. Developed Parvo Virus and came home with really red cheeks. And they call it slap cheek syndrome. The cheeks are just flaring red. So I took her to the pediatrician because I didn't know what was wrong. And when he said that's what was going on, and generally Parvo Virus is usually kind of self-limiting. You don't have, it just kind of goes away. They don't give you anything for it. And kids get it from respiratory secretions, when kids have colds and runny noses. I didn't realize at the time there was actually 4 or 5 kids in her class that had it. But again, she wasn't considered infectious. By the time we saw the symptoms, she was pretty not infectious any longer, and she had had a cold for a short time. But then over the course of the week, it just looked like all of a sudden she was growing and just looked different. And I said to my husband, are these growing pains or what? What's going on? Because she just was just different. And about a week later, I identified that she was beginning to swell. She had a lot of swelling on board. And her face was fuller than before, but at the age, I didn't know if she was just changing or exactly what was going on. But when I really started paying closer attention to her symptoms, because she still felt fine, she was still on the playground playing and pretty active. Then I looked at her feet because her skin just felt so tight and hard to me, and her feet were tighter than before, and I started feeling it. She had a lot of swelling and edema in her feet all the way up to her knees. And, of course, the next day we rushed right back to the doctor, tried to figure out what's going on. And at that point, I was really terrified. And, again, she was feeling fine, but, just the symptoms were just so acute. And what they diagnosed was acute nephrotic syndrome, and didn't know the reason for it. And so she went through a battery of tests, and, went to the ER and did the 24-hour urine and a number of things. Her kidney functioning, her tests were fine, so it showed that her kidneys weren't, the functioning was still okay, even though she had these symptoms right then. So it was diagnosed as minimal change syndrome, and it occurs in kids sometimes as a result of having a virus. And usually it's something, or it could be something bacterial with strep throat. Lots of times kids have strep throat. But she didn't have strep, we know she did. This is a child that whenever she complained of an ear infection, we took her to the doctor and she was treated quickly, and most times didn't even need to spike a temp because we usually caught it pretty early. But we know she didn't have strep throat, but she did have a viral syndrome, and it's the Parvo Virus. And so they started to treat her initially because when we took her to the doctor, she had 13 pounds of fluid on board. And that's a lot for anybody, but for a child. Within a week she lost 13 pounds when they gave her Lasix to get rid of the fluid. And after a couple of days of trying to manage the fluid, then they placed her on steroids. So she was on high-dose steroids for a long time, and the plan was at least 12 to 16 weeks of high-dose steroids because that seemed to work most effectively in kids. And again, the minimal change in children sometimes happens very acutely, but it can be managed, and if they're on high-dose steroids for a longer time, they tend to resolve over a period of time, and it wasn't supposed to have any long-term effects. But meanwhile, you're going through this real frightening episode and not sure what's going on, and we're going through it step by step. And as quickly as these things happened, we went from doctor visit to doctor visit, doing whatever they said needed to be done to take care of her. And initially, she responded really well. She got rid of the fluid within days, was on high-dose steroids, and felt fine, though. Did well, and the protein in her urine, she had protein in her urine, of course, and that started to clear up. So, at that point, being, with parents that are just terrified about this child, you'll do whatever's necessary, and that's what we did. And we were still afraid of steroids long term, but despite whatever side effects you have from that, we wanted our child to be better. And so for the first 6 weeks, she really responded well, and she was on 75 milligrams every day. And that's pretty high dose. And then you hear people tell you all the bad things that can happen of being on steroids so long, especially as kids go through the change of life with puberty. Then meanwhile, that wasn't important. We just needed to get through this acute phase. And so for the first 6 to 8 weeks, she really did fine on that therapy. And then then they started to taper the prednisone, and the plan was to get her on a lower dose, and then manage her on that for the rest of the course, and then to taper it off. Well, whenever they got to 40 milligrams, it started to flare up again, and she starts spilling protein again in her urine. So we could never get her under 40 milligrams. And it was, we'd go from 60 to 40, and we'd go right back up. It was back and forth process. So then the plan was, they started a chemotherapeutic agent. And it was a pill that was taken every day. And the reason being, you know, one study showed that it had been effective in handling and managing minimal change syndrome. So we took that for a while, and again, you know, we're just blindly going through whatever's going to make our child better. And there are side effects with this agent, just like any chemotherapeutic agent, with the, you know, the hair loss as well as alteration of white blood cell count. But by this point, she's been on prednisone so long, she started having real Cushing syndrome, you know, round moon faces and everything. And again, it doesn't matter when you just want your child to be well. You know, those are secondary things you'll deal with, the change of body image. But meanwhile, she was on all this therapy, and then all of a sudden, after 8 weeks into it, just was not getting better and not responding. And we went from, you know, one medicine to the other. We added the chemotherapy. She was on more prednisone, and we just couldn't get it off. And we had gone through a real rocking course because this started in March. So by now, the summer's over, school's starting. And the first week of school, the doctors decided that since she wasn't responding to the steroids by mouth, they needed to give her IV. And she was going to be getting IV steroids a couple times a week, you know, that lasted with a high dose. And the plan is that that would hold her over, and, you know, she wouldn't need to take the pills any longer. Well, I talked to someone I know that's a pharmacist, and he scared me to death about that, because he said, well, if she's not responding to steroids by mouth, why should she respond to an IV? And then as a parent, I'm thinking, I don't want my child to have to get IV medication unless she needs it, because she would probably need a central line catheter, invasive therapy. And again, if indeed I really felt like she was really going to get better, we would have done it. But at that point, I just felt like we were going from one thing to another, and she wasn't really getting better. And with the side effects of all the different medications we were going through, it was just a whole lot. Well, we had in the back of our minds trying something different, and the homeopathic medicine. And a few years ago, my husband actually had gone to Dr. Mueller as a recommendation of some friends of ours, and he had hypertension and chronic sinusitis. And with making major changes in lifestyle and taking vitamins, he really did do better. And he was able to get off antibiotics, and he had been on antibiotics